Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner and a nurse educator. In today's video, we will be going over 5 mental health NCLEX questions courtesy of nursing.com. Nursing.com is an excellent resource if you are in nursing school. They have courses, cheat sheets, practice questions, study plans, sim clocks, have videos, and their courses and videos can guide you through nursing school so that you can consolidate studying and focus on what you really need to know. If you want to learn more about nursing.com, check out my affiliate link below. A nurse is helping a family whose father is dying of cancer. The nurse notes that one of the grown children in the family does not want to talk about the situation and often leaves the room when the group discusses topics about their father's funeral. The mother tells the nurse, "I'm so hurt that my son will not talk to us. He must be angry." Which response from the nurse is most appropriate? He may need counseling later on, but for now we'll try to get him involved. Everyone grieves differently, and it is probably nothing personal against you. He probably is hurt that everyone wants to discuss the funeral so much. I will tell him that he needs to talk to you and that you feel bad. I'm sure you know this, but if you don't, as nurses, we put on so many hats, and sometimes one of them is almost like counselor / therapist. Have to utilize therapeutic communication and be empathic and compassionate, and this is the best option. Each person experiences grief in his own way, and how one person responds is usually different from the next person. In this case, the grown son is most likely grieving because of his father's illness and is expressing it in his own way. A client is undergoing a clinical interview as part of diagnostic testing for bipolar disorder. Which best describes why a clinical interview would be conducted? To measure the client's IQ level, to assess the client's psychiatric and family background, to determine how the client perceives and cognitively understands, to test the client's memory function. So it's important to, when you're diagnosing somebody with bipolar disorder, it's important to get a thorough background. For example, do they engage in specific reckless behavior like increased spending, hypersexuality, illicit drug use? And also, does mental illness run in your family? Is there someone else in your family that has bipolar disorder? Because there is a genetic component to certain mental illnesses. A clinical interview is part of an intake assessment of a client that involves talking with the client to gather important data that could later be used as part of treatment. The reason for the clinical interview is for the clinician to assess the client's current symptoms, background, including data about family, personal history, and psychological diagnoses. A 25-year-old woman is in the emergency department after being this. I just don't want to say it, and then YouTube flags the video. That specific nurse examiner is working with the client and providing care. Which of the following would the nurse consider while providing care for this client? Ensure that the client is admitted to the hospital. Stay with the client from the time that the client comes in until discharge. Arrange for follow-up care and counseling after the client is discharged. Keep the client informed about the progress of finding the perpetrator. It's unrealistic that the nurse will be able to stay with the patient until discharge. So I'll just say the SANE nurse is a nurse who specializes in caring for those who have experienced that and collecting evidence about the crime. This nurse would need to ensure that the client has someone with them to care for her when she's discharged, and that she receives follow-up care through counseling or a support group after dismissal from the facility. Some clients who have experienced that do not need to be admitted to the hospital as an inpatient. Like I said, it's not realistic for one nurse to stay with the patient until discharge. What if that patient is coming in right towards the end of that nurse's shift? And the client should not be reminded of the perpetrator, as this is often extremely upsetting. Now, like I said before, everyone is different. I feel like if that were me, I would definitely want to know, like, has he been caught? But the best answer is that they're going to need counseling. That's the best answer. A client states that she feels significant stress while caring for her young children. She has developed headaches, she is irritable, and she gets little sleep. Which of the following nursing interventions is most appropriate for this client? The client is already verbalizing that she feels stressed, so that's already been done. Explore feelings and survival tips that can help get through the current situation. Some clients feel significant stress and do not have solutions for how to reduce the intensity levels of this stress. The nurse can help this client by exploring the client's feelings and discussing ways that the client can make small improvements. Rather than the nurse attempting to solve the client's problems or giving basic advice, the nurse should actively listen and work with the client and family members as they problem solve. A nurse is working with a client who is having trouble accepting that her husband has left her, which best describes how the nurse would use active listening to work with this client. Select all that apply. Tap the foot lightly on the floor. It just seems like you want to get the conversation over with. I feel like if you're listening, you lean forward, not back. So steepling of the fingers actually conveys a sense of distance, distraction, impatience, and authority. And also leaning back shows that you're distant. And I've read a lot of books on body language and what certain body language means. And if you want to show someone that you're listening, you would lean slightly forward, not backwards. And what they mean by use sounds of encouragement while client is talking, and not everybody likes this, but as women talking to another woman, we show that we're listening by saying things like, oh, really? Oh, okay. Whereas sometimes men can talk to each other and be completely silent. So this is a different in genders. I'm not saying all men don't make any of these noises, but I feel like as women, a lot of the times we will ask guys like, are you listening to me? Because they don't offer these sounds of encouragement while we're talking. And if you nod slightly during the conversation, not like a bobblehead, it also shows that you are listening. Which of the following client responses to a critical illness would most likely warrant a nursing diagnosis of spiritual distress? Showing lack of interest in self-care measures, demonstrating denial of the situation and becoming apprehensive when anyone tries to talk about it, repeating the phrase, "Why is God doing this to me?" to everyone he sees, crying and expressing feelings of helplessness. So this is spiritual. So this one is the only one that mentions God, so I'm going to go with that one. Spiritual distress occurs when a person's spiritual beliefs are challenged. Spiritual distress can affect a person's physical and emotional well-being and is manifested as guilt, resentment, lack of meaning, despair, unfairness, being troubled by lack of faith, and death fixation. A client who is experiencing spiritual distress would most likely manifest the situation by questioning their personal belief system. Thank you so much for watching. Make sure that you hit that like button and you smash that subscribe button. I currently have a goal of hitting 30,000 subscribers. I've been at this for 3 years and still haven't reached it. So it would mean a lot if you subscribed, and keep in mind that it doesn't cost you anything to subscribe and you can always unsubscribe later. Until next time.